That's what I want is health and healing for families. I don't have some like, let's make you a cookie cutter Jones family.
Yeah.
That's not what I'm about. Now, can't speak for all therapists, but especially the therapy we do here, we're really about families achieving their full potential.
Hey everyone, welcome back to another Family Care Learning podcast. My name is Brandon Jones. I'm the Clinical Services Manager with Arizona Family Counseling, a ministry of Christian Family Care. Today I have Sarah Earls with me. She is one of our child and family therapists. Sarah, thank you so much for coming. Today, what we're going to be talking about is the involvement of parents in a child's therapy. And so can you tell me a little bit about the importance of, how important is it to involve parents in children's therapy?
Yeah, well, I think that parents are vital to children's therapy. It's really not going to have the same benefits or the same results if parents aren't involved everywhere, and everything from like practically to what they're learning, how they're applying it, the actual healing that takes place. If parents aren't involved, kids can only go so far.
Yeah. I think a lot of times, right, in there's a variety of expectations. I think parents come in when they bring their children to therapy. And I have some where it's like parents want to be involved like in every session. But then I have others that are kind of like, can I just drop them off and not be involved and I'll come back or whatever. And so you mentioned that this is of vital importance. How is it vitally important for children in therapy session?
Well, yeah, and you said like some parents want to drop their kids off and not be involved. Like even the process of bringing the children to therapy is involvement. So the way that the parents approach therapy and approach me as their child's therapist really makes a difference. So the parents that exhibit that they trust me, that they think that I can help, that this is going to be a good experience for their children come in much more calm. They're more ready to engage versus the ones who are like flying in, flying out. You're here because you're bad. I'm just going to drop you off with this person. The kids are afraid. They see me as a disciplinarian.
Yeah.
We have to work a lot on just building a trusting relationship where if the parent comes in and says like, even if they're going to sit out in the lobby or go run an errand. Like if they're bringing their child in with an attitude of, I trust this person. I want this person to help you. The child's going to do a lot better. Oh,
that makes so much sense. Thinking about the work that we do with foster and adoptive families and trying to support children that are transitioning from whether it's from home to school or from school to home or childcare. One of the things oftentimes we're encouraging parents is exactly that, right? Like because they already have trust usually with their child, conveying or kind of connecting that trust of, okay, I can trust Sarah. And so how might be some ways that parents could kind of convey that trust? Is it really just kind of interacting with you and kind of just having some conversation?
Yeah. So what I do for parents bringing their children in, we kind of talk about, is this a child who needs some personal space and needs to be separated from the parent or to have that safe space? Or is this a child that we want the parent in every session? Because I think the parent can be involved both ways.
Yeah.
With that being said, I try to have the parent in with the child for at least part of the first session because I feel like that's part of kind of giving that trust and showing that the parent can work with me as well as the child. So the child can then model like, oh, the parent talks to Sarah this way. Mom says it's okay for me to play games here, so I can play games here. Or I know, even just the basics of like how to get back to the office and back. Things like that. So that first session, I'm going to try to involve the parent to some extent, just to make sure that the child knows the parent sees this as a safe place. The parent sees me as a safe person, and is this a place that we could do some work.
Oh, I love it. I love the intentionality you and the other therapists bring at Arizona Family Counseling, where just even the handoffs or the transitions, it's all intentional in really helping the child increase regulation. And so you're saying vitally important, even in the handoff or the transition, driving to therapy, talking with the therapist. How else is it the parent involvement important?
Yeah. So like I said, we're going to kind of weigh when we do the family's treatment plan, what's going to be best for that family and child. Typically, it's some arrangement of some individual sessions for the child, maybe some sessions for the parent without the child, and then some with them together. But I think a vital thing is for the parents to kind of set the child up for what's going to happen. So if they're sitting with them, kind of that co-regulation piece of helping the child stay calm. I have a lot of parents and kids who meet with me together.
Yeah.
And although part of what we're working on is the regulation skills, the calm, so that we can learn, a lot of times I don't really have as much sway as the parent does.
Yeah.
So it's that parent saying, hey, like, let's listen to Miss Sarah, or, hey, you know what, you're not really feeling well. Or a lot of the physical regulation, like rubbing their arm, giving them a hug, other things that aren't really appropriate for me to do because it's not my child.
Yeah.
But that the parent can really help just in a physical way.
Yeah. For those viewers that maybe aren't really aware, can you talk a little bit about what co-regulation is and how that is, like, what is that with a parent and child?
Yeah, so I kind of see it as like a mirroring.
Okay.
So regulation means like our bodies are calm, our heart rate is appropriate, our breathing is not necessarily like so slow that we're sleeping, but
Right.
not hyperventilating. So our body's not showing signs of stress, of anxiety, of being really overwhelmed with emotion.
Yeah.
And that's something that kids naturally need. Up until like their preteen years, and kids who've been exposed to trauma need it for even longer because they are recovering from this period where things were just way overwhelming.
Yeah.
So that co-regulation piece is basically that parent being calm in the session, and kind of that's something that they can convey to the kids or even give to the kids. So if the parent comes in and they're stressed out about work and they're sitting there punching on their phone or talking on the phone, or even the parents who are really stressed thinking that their child has to behave in my office, that child be more intensively stressed, anxious, maybe even misbehaving.
Yeah. Ooh, so what I'm hearing, right, like the parents have a vital importance in helping a child be calm. As you were kind of talking, I'm almost, I get this image of, like, I think about a parent holding a baby, right? When I'm holding my little babies I've had in my home or in my family, and they're crying and upset, and right? Like, it's my ability to stay calm and rock them and meet their needs that eventually they calm down. And so really are you saying it's kind of that same dynamic even with older kids?
Yeah.
Interesting. I love that, right? It just that again, that idea of that makes so much sense, how vital a parent is with that role of, hey, it's okay, I'm going to calm you, right? You don't have to be afraid of Miss Sarah, right? This is a place to be regulated, but also a place to make sure that you're listening and obeying. And so any other ways that you see that they can kind of contribute at all to the session or the vitality of what's being accomplished?
Yeah, so Dr. Bruce Perry has kind of the regulate, relate, reason framework.
Yeah.
And so I think that first piece is helping their child be regulated. And then, a lot of times we are working on relationship things. So the parent has to be there or be involved in the child's life in order for that to happen. So maybe it's that we're working in session on how we treat one another, or on sharing our thoughts and feelings. Built on that thing of we're both in a calm place. Because if little Joey is wanting to run out the door, or, dad's tapping on his cell phone, we're not getting that relationship piece. And then if we've got those two pieces going, then the child feels in a safe place, and we can start working on the reasoning, the changing some of the negative thought patterns, changing negative behaviors, that type of thing.
Yeah.
And then that's really where the parent comes in and helping the child get the most out of therapy, because they're learning along with the child. And so then they can implement those things in their home, remind them of them. So, maybe it's kind of doing a check-in at some point with a child, or maybe sometimes I'll give the family specific homework, like, okay, little Joey, I want you to sit down 3 times a day and take 5 deep breaths.
Yeah.
Or sometimes it's a relational thing too, of like, I'll be, noticing in session a certain pattern and say to the parent, okay, like, I need you to use your relationship to help build some resilience in this child, or to help remind them more frequently that you love them. especially for our kids from hard places, they need extra reminders that their parent is there to keep that co-regulation.
Okay.
So that parent is going to really help implement what we do for 1 hour, and they can decide if that's going to be just 1 hour of the child's week or if that's going to be multiple repetitions throughout the week so that the child can really start to have the healing take place, have the things that we're trying to teach become part of life rather than just like, oh, we're going to go to the doctor basically for once a week and hope that fixes it.
Right. That I could imagine therapy progresses so much faster when they're practicing those regulation things, right? Like you're saying multiple times, I'm thinking about like anyone that does anything, working out, eating healthy, only doing it one time a week is probably not going to get a lot of traction compared to if they're doing it daily and then reinforced with therapy. That makes so much sense. Now, you mentioned this regulation and helping the child transition, and really the parents being an active participant in kind of furthering the work of the therapy in the home. Yeah. Would you say this is true? Are there only like specific clients this is true for, or is it kind of any client that a child need that we're working on?
Yeah, I'm going to say it's any client. Like like I've said, a lot of times we have the parent in session. Sometimes we don't. Yeah. But even in that case, I'm communicating with the parent in their own separate session saying, not like everything that little Johnny is saying, because that would be breaking the child's safe space to talk, but saying like, we're working on these coping skills. Could you look at those at home? A lot of times I have sessions with the parents separately to say, tell me what you're seeing. Because together we can figure out like, oh, here's a trigger that's happening for this child that is completely dysregulating them, kind of getting them way off course. And hey, together we can make a plan to deal with this. Yeah. The other thing is that families are a system. So when the kid changes, it's often because of something that's changed in the family. Ooh, and then parents may have to make adjustments. So it can either be a positive system change or a negative system change. So, you know, sometimes little Johnny starts behaving better and then little brother decides like, oh, I'm going to make a scene now. Right. And the parents have to readjust. Or sometimes it's like, okay, we have a child who has a brain difficulty and we need to acknowledge this, and we're going to have some different ways to help them than our other children. Maybe we're going to have to like actually stand by their side as we teach them to do chores versus, you know, tell the child, go cross this off your list. Or maybe, you know, we're going to have them have an IEP at school and we need to advocate for them on their behalf. Or, you know, maybe their capacity is here, and even though they're, you know, 8 years old, because of what's happened in their brain differences, I need to give them support more like a 5-year-old. Yeah. So that parent piece of making changes to adjust for the child is then going to, again, propel that child to be able to fully reach whatever their potential is. Oh, I love it. And so I really enjoy, just as both a therapist, but then as a parent, thinking about this relationship that you described between the therapist and the parent in working together and communicating. And so I'm thinking, even if the therapist doesn't take the initiative, if you're not working with CFC therapists, Arizona Family Counseling therapists, that would be a good thing for parents to even kind of ask, right? As far as like, hey, so what are you working on in therapy and how can I work on that at home? And so any other final pieces of advice or recommendations as far as parent involvement with children in their therapy? Yeah, I guess just as a therapist, I want to say to parents, like, you're the experts on your kids, so don't be afraid to advocate for your kids and say, like, hey, therapist, like, this is working or this isn't working or I have this issue. Yeah. Because I always want to honor parents' role. They're with their kids 24/7. Yeah. And I see their child maybe once a week for an hour. Some kids, it's every other week. So I want parents to know, like, they're the experts, and I just want to help with the perspective that I have, with the education that I have, be able to support them in their child reaching their full potential and their family reaching their full potential. As a therapist, like, that's what I want is health and healing for families. I don't have some, like, let's make you a cookie cutter Jones family. Yeah. Yeah. That's not what I'm about. Now, can't speak for all therapists, but especially the therapy we do here, we're really about families achieving their full potential. So with that being said, like, what's the role of parents in therapy? Like, it's vital. It's one that nobody else can fill.
Yeah.
So I really want to encourage parents to be encouraged in that and to not be afraid to take an active role in therapy, because their spot is one that nobody else can fill, not even the best therapist in the world.
Oh, thank you so much, Sarah. Thank you for joining us today. And for those of you watching, if you have a child that is struggling with any issue related to mental health, behavioral health, please look at the description below. The website for Arizona Family Counseling is there. We would love to partner with you, parents, in helping strengthen your family and serve your child to achieve wholeness, healing. Thanks again for joining us.